Hello, welcome to My Body, My Rules. I'm Dr. Darren, and this is Dr. Goodrin. And we are from Ulock & Young Chiropractic Health and Wellness Center. So today, we're talking about...
Today, I wanted to come to you with a problem. I have this weird symptom where after I eat, I feel this pain behind my rib cage here. And I was talking to my neighbor, and they were saying that their cousin had a similar pain, and it ended up being pancreatic cancer. And then I was talking to my mom, and she was saying that a friend of ours this happened to recently, and it was a heart attack. And I went to the health food store, and one of the clerks there let me know that it's probably this serious digestive problem called SIBO. And
So have you had any treatment so far?
No.
No. And you know why? It's paralysis with analysis. Everybody has an opinion, though none are formally trained as a healthcare provider. And have you visited Dr. Google?
Of course.
Well, of course. So now Dr. Google has thousands of possibilities. So now we're analyzing even more what could possibly go wrong. And we still don't know what's wrong. So that becomes an issue for people, is how do we figure out what the proper diagnosis is without going astray and spending money on a treatment plan that's totally not necessary, or spending time searching for something that's not formally put together by a healthcare practitioner.
Yeah, and I'm going to switch people now and be a healthcare practitioner. And we've definitely seen people who have paralysis by analysis also by going to many healthcare practitioners and doing many different tests and getting many different opinions, and a lot of them are opposed to each other.
Yes.
So that's another way to get very confused. Sometimes a lot of my patients come to me with like a huge pile of paperwork, and it's test after test after test showing normal results, and so they're a little lost, and then when they come to me, they're a little confused as to what exactly are we treating. But what Dr. Darren and I try to focus on is looking for the actual root cause of what the problem is, or the primary cause, as you call it.
Right, and that's the difference between this stack of medical tests that are looking for very specific things that may come back normal, and then looking at all these different test results and trying to piece everything together to find out what is the primary issue, what are the secondary issues, and really looking at the body as a whole and trying to sort out where the origin of the problem is coming from.
And so how would somebody know to trust your diagnosis and your treatment versus many of the other ones out there?
I think going through the appropriate tests and talking to the patient and getting a really clear health history is key. Providing proper requisitions for tests is important, but being able to read and understand and interpret those tests are also very important as well. So following the treatment plan then becomes very important. So for some people, they have gone to a healthcare provider, been given a treatment plan, but there are no follow-up checkpoints to see how things are progressing. Like, are the symptoms actually going away, or is it not going away? Are they getting worse?
Right.
And then what's the purpose of the treatment plan if it's not the direct way to solve the problem?
Yeah, because a lot of people are either getting worse or not getting better at all, and then that lends to not trusting the next healthcare practitioner.
So then those people are skeptical about trying another form of treatment when they weren't diagnosed properly the first time, which is now influencing their decision-making process for the next time when they really should follow or find the right doctor, healthcare practitioner, chiropractor, naturopath, whoever it is, to get the right diagnosis and then maintain that treatment plan. And doing one treatment plan at a time, right?
Right.
There are many times we have had people come in and they are following multiple types of treatment plans from different directions, and it's not working.
Right. And it
And
makes
then-
it very hard to follow our treatment plan if somebody
Yeah.
else who's saying something else is telling them the opposite, so.
Exactly. So to avoid paralysis with analysis, first of all, try and stay away from Dr. Google. 2, have a really good conversation with your healthcare practitioner. And if you happen to be seeing a health provider that only allows you to talk about one symptom at a time per visit, that's probably not the way to go. Right?
Yeah, and a good healthcare provider will, if you did go down the Dr. Google path, will answer your questions about your fears and that sort of thing.
For sure. So it's my body, my rules. Make sure that you ask the proper questions. Make sure you understand your diagnosis and that it makes sense to you.
And that you
And
have
follow
proper
through.
checkpoints along the
Yes,
way.
and make sure that whoever you're seeing is doing progress evaluations with you, checkpoints, to make sure that you are actually getting better. Alrighty.